Hello, everybody. This is Keaton, Andreas, the Assistant Director of Outreach with Child Family Health International. I actually am joining you today from my living room because the Warriors won the NBA championship and there is a gigantic parade clogging up public transit. But today I have with me a CFHI alumni, Joshua Kaine, an alum of also the University of Kentucky. But Joshua, please introduce yourself.
Yep. So, like Keaton said, my name is Josh Kaine. I just graduated medical school from University of Kentucky, and I'm starting my residency at Brown University in Rhode Island for emergency medicine. And back in January, I went with CFHI to northern India as part of their rural urban Himalaya program.
Thank you for being on this hangout with me today, Joshua. This is part of a new series where we're trying to bring the experience of our alumni to other CFHI students and other students out there to learn what it's like to be involved with us and what it's like on our global health education programs. So, Joshua, while you were in India, what were some of the key takeaways or one of the key observations? Like, what impacted you the most while you were there?
Yeah, so I think it's easy to say that the system there is very, very different than how things are here in the U.S. And really, like, one of the most interesting things here is I think in the U.S., like when we think of homeopathic medicine, like the things you see on the internet or TV or hear on like Dr. Oz shows or stuff like that, there's immediately like a negative stigma associated with it. And then allopathic medicine, or like kind of like the traditional, you go to the doctor, you get a pill, or we do X, Y, Z to you, is kind of like the standard here in the U.S. And in India, it's not exactly the same. Allopathic medicine and homeopathic medicine kind of coexist, as well as a third type called Ayurvedic medicine, which is traditional Indian medicine, where they use kind of like herbs and oils and different techniques to basically treat disease. And there's surprisingly a lot of evidence for it, like that it works, more so than some of the homeopathy that we see. So there's a really big difference than like back here is just these three types of medicine coexist and kind of work hand in hand. And when one kind of reaches its limit, they'll like suggest they go see the other one. So if someone's being treated for something using allopathic medicine and pills and it's not working and there's nothing else to do with traditional, like, American style medicine or Western medicine, they may go see an Ayurvedic doctor and try a different type of treatment using more traditional herbal remedies or something like that. And same thing goes the other way. Some people may prefer to see an Ayurvedic doctor first, and then those doctors, if they can't help them, will ultimately refer them to an allopathic doctor. So it's a really interesting interplay that we don't necessarily see here in the States. So that was one thing I thought was pretty interesting or unique. Let's see. Another thing I thought was pretty interesting was just the dynamics of a clinical encounter in India, which here in the U.S. we put like a ton of focus on patient privacy and individualism really throughout the whole clinical encounter. And there it's just completely, totally different. The patients, for instance, in one doctor's office we were at, the patients were lined up in the hallway and also like in the doctor's office where he was seeing patients. So at one point, the doctor had the patient he was treating in front of him and then lined up on a bench on the wall would be the next 5 or 6 patients he was going to see. And he would conduct the entire clinical encounter, in front of everybody, just kind of to see and observe and physical exam and everything. And if it was like a super private thing, they'd take him into a different room. But generally speaking, the whole encounter was kind of a public affair. And at first I saw this and I thought, oh, maybe this is just because they're dealing with like low income individuals. And that really wasn't the case. We had a time where this state judge came in and he was subject to the exact same, kind of process. He got to skip to the front of the line, which is the one perk, but his entire encounter took place in front of this audience. And really it was kind of a testament that that's how their system is in general. Like I said, it's just very, very different than the U.S. There's like none of the HIPAA stuff, none of the, keeping charge super private or the whole thing. Just it's so different in that regard.
That's I think really informational for students considering going on these experiences, kind of the situations that you're describing being so different from how we approach things in the United States. And I think within that is a second question and a second conversation about how we even approach travel internationally to begin with. And so CFHI's motto is "Let the world change you." You probably saw that on our materials before going with us. But you made an observation in your blog that you sent to us about reinforcing the local healthcare systems versus sending in large groups of people on, for example, a brigades model. If you could unpack that reflection, I think that's something that CFHI is always pursuing on their own regard too, through our academic research and through sending students into our programs.
I'm happy to. So that reflection was written largely about Landor Community Hospital in the town of Moosery, which is a rural town that's pretty small, up in the mountains. And what's there is the hospital was originally built as a Christian mission hospital, and it's been around, I think it was like 70 or 100 years or something like that. And so they've really become a part of the community that's there. And they've been supported by outside funding, and really they exist to kind of serve. And what, I guess where that whole notion of like building the existing facilities came from was seeing kind of how that hospital operated. They had two basically interns or residents there who were the primary doctors that took care of most stuff. And they had a couple specialists who would come by like once a week who were all like native, like Indian doctors. And, through that system, the people who were there would learn, the individual skills they would need to kind of take care of all types of patients and all comers without, why is that? Like the specialists, when they would come in, would basically spend time teaching the interns and the residents how to, take care of each subspecialty so that they could be equipped to like teach everybody. And what was really interesting about it was while we were there, we met Dr. Bona, who is a traveling, he was a general surgeon who did like after the fact training in plastic surgery. And he had come to the hospital for a stint of like 6 months to help out. And instead of him just sitting there doing cleft palate surgeries and, being the one man operating, he was there teaching the residents basically how to handle surgical cases. So he had these non-surgical residents, and he was teaching them how to do basic things like C-sections and appendectomies. And he's basically taking his time, instead of doing the services himself, training and equipping the people who are there to do these surgeries in his absence. And that's really, I think, one of the things that made it a unique experience is, that he was basically equipping the hospital and giving them the skills. He wasn't just giving a service, he was teaching them how to function to that higher level in his absence, which kind of makes it a more sustainable project because he won't have to be there. He's not needed to do all this stuff once he trains them, and they can continue providing those services for years to come and train the next set of doctors who are coming through. And that, I think, is a really, really different approach to mission medicine and just going to other countries than like the brigade model that we had talked about, or like kind of going somewhere for a week or two and providing services and then disappearing after the fact. That's great. You do provide care and you help, but does it have the same type of impact? Will it have the same lasting change as, going and teaching people how to do stuff? And I don't think it does necessarily. It does help out some people, but it's not necessarily the lasting change that programs like, or the hospital like LCH kind of has. So I think it's pretty valuable to be able to come in and teach the existing system and the people who are there, new techniques, new methods, more modern things to improve their existing system rather than bringing in your own system temporarily and then taking it away later.
Yeah, and would you say that speaks to our role as like foreigners in a new setting as well, that taking that posture of maybe teaching but also learning is something that would help kind of change the dynamics of some of these models that we see out there?
Oh yeah, completely. And this may be kind of selfish, but like I felt like I learned a lot medically speaking from the experience. Just because like the hospitals that were there kind of resource poor settings. For us, it's nothing to order an X-ray or a CAT scan or something. And the clinics and the hospitals we're in didn't have that. And so it was neat for me to see these doctors and physicians relying on like clinical skills and to make their diagnoses and do stuff, and like more on emphasis on physical exam and less on like diagnostic measures and stuff. And so that was a neat, and I guess that was another takeaway for me, was that in these settings without necessarily all the resources, we as visitors have a lot to learn too about how medicine used to be practiced or what to do in the absence of all of our toys and technologies that we have here in like first world countries too. So it's pretty neat.
Yeah, and I would imagine that we could continue talking about this for a very long time, but I'm going to leave things here in a little bite-sized setting for our audience. Thank you so much for being again with me today in this conversation. For anybody watching, you can learn more at www.cfhi.org, and if you want to get in contact with Josh, I'm sure he'd be happy to speak with you, and I can arrange that. But until next time, this has been CFHI, a conversation with our one of our wonderful alums, and thank you again.
Yep. Thank you.
Yeah.